and then you will see a very dark brown marking here, like that, around here. Now that means that that body is very toxic. It's 1, 2, 3, 3.5 rings. These are rings like that, known as stress rings. Can iridology detect hormonal imbalance? I'll repeat that. Can iridology detect hormonal imbalance? It most certainly can. Now, I've been working with iridology, the science of iridology, since 1976. And I've done over 38,000 pairs of eyes in 28 countries so far, and doing more. Now, what actually happens is that when you've got an hormonal imbalance, it can register in your iris, all right, and I'll explain what that means in a minute, and it can address in your iris, and certain markings on there can indicate whether your hormones are out of balance, right? Now, so what we do is we use a chart like this, okay? Now this chart was put together after 700,000 patients were assessed, right? 700,000 patients were assessed, and by top people across the world in the world of iridology, massive experience of 50, 60 years. So, and then using this chart, we can actually tell imbalances in many, many organs, right? Now, so we understand clearly what's happening is that when you look at the eye, you've got the pupil here, okay, which is where your vision is, where you see things through. You've got your pupil here, and then surrounding your pupil is this part here, this part, and that is called the iris. Now, the iris is actually an old Egyptian word meaning rainbow. So pupil, iris, and then the pupil and the iris sit in the sclera, which is the whites of the eyes. Sclera means white. So you have three components that you see readily: the pupil, the iris, and then sitting these two key organs then sit on the sclera, right? So that's how you can see the markings that you require for detecting several diseases in the body. Okay, now, so that's one. Now, so using an actual live copy of someone who's got an hormonal imbalance. Now, this is the person that's the right eye of someone who's got hormonal imbalance. The right eye. You can see from the corner here and the sharp, that is the right eye. If it was like that, it would be the left eye. But that is the right eye. So how do we detect hormonal imbalance? If you look here carefully, you look at it here, you'll see that's the pupil here. And then you will see a very dark brown marking here, like that, around here. Now, that means that that body is very toxic. Okay, very toxic. That person's eye should, at the very least, should be from here to here and here to here, here to here, here to here, should be this color hazel. But you can see a very dark brown mucky color there around the pupil. And that means that the ascending column is toxic, the ascending column is toxic, the transverse column is toxic, and then that's, to be precise, that's the right side of the eye, right side of the body, ascending column, transverse column. And then these from here to here are the right small intestines. Now, right around there, you'll see here, I can show it to you, 1, 2, 3 rings, right? There's 3.5. There's 1, 2, 3, 3.5 rings. These are rings like that. And it's like a depression in a field, right? So these rings are known as contraction furrows or stress rings. So when we're looking at the different sectors of the eye where the hormones can be seen, the hormonal balance or the hormonal systems can be seen. When you see 1, 2, 3 rings like that, 3.5 rings, that person has definitely got imbalance in the hormones. Now, the great thing about it is that once you've detected that the stress is there, again from the number of contraction furrows, or also known as stress rings, that means that the hormonals are stressed. Okay, that's what it means. Now, so then what happens? We then can work out what supplements to take. For example, like magnesium, calcium, and many other minerals. Like, for example, like the key ones like magnesium, calcium I mentioned before, but also other things like iron and other key mineral factors. Okay, now, so if you want to know more about how to find out more about your hormonal imbalance, go to this QR code there, right? Register in there and you'll get access to a free 15-minute telephone conversation with us where you can discuss about your problems with hormonal imbalance, and then we can give you some very good guidance over 15 or 20 minutes about how we can help you with a consultation that you can come and see us, and we do a 2-hour consultation. 2 of us work the whole 2 hours, so you get a very thorough approach to getting your consultation, and we can help you solve your hormonal imbalance for no matter any other disease that you've got. Okay, now if you like this video, subscribe to the channel, select the bell notification, and pass your comments. I mentioned this QR code, you've seen that. Now, we also recommend that if you want to know more about how to deal with your body, how to deal with your body's imbalance, give us a phone call and we would be delighted to talk to you about it.